All right, well, I think we're going to get started here. Hello, everyone, and welcome to the Healthcare Homes webinar. Our theme this month is healthcare. It's not a health home without oral health. My name is Katherine Johnson. I am the learning manager. I am taking over for Carol, who is currently on her well-earned retirement. So she's enjoying retirement and staying very busy, it sounds like. So I appreciate you guys letting me come and try and fill her shoes. So we are joined by Deb, Jane, and Nancy, who will be presenting shortly. Next slide, please, Sadie. The Minnesota Department of Health recognizes, values, and celebrates the vibrant and unique relationship between the 11 tribal nations and the state of Minnesota. MDH believes that the partnerships formed through government-to-government relationship with the 11 tribal nations will effectively address health disparities and lead to better health outcomes for all of Minnesota. Next slide. We're just going to have two quick healthcare homes updates, and then we'll begin our presentation. For those that aren't aware, we recently changed and moved all of our e-learning from, it's still on the same platform, but we've moved the access to our MDH e-learning website. You can have direct access to all of our lists of courses, and it allows you to find our courses very quickly and not have to search through the learning management system. So please feel free to navigate to our e-learning tab on our website, and you will find all the courses listed there for you to choose. Next slide. Also, please check out our YouTube playlist. We have posted all of our previous webinars, except for the last couple, which we will post as soon as we are able to. And you can find some other, you can find the rest of our videos on the YouTube website channel. Next slide. All right, it's not a health home without oral health. Next slide. We'd like to welcome Deborah Jacobi, Jane Neubauer, and Nancy Franke Wilson. I apologize if I mispronounced your names. Perfect. All right. They are here to present about oral health in home healthcare, in healthcare homes. Next slide. Learning objectives upon completion of this webinar. Learners will learn oral systemic health connections and its implications for whole person health homes. You'll be able to utilize in Minnesota State Oral Health Plan, and medical dental integration resources from the Minnesota Oral Health Coalition and the Early Childhood Dental Network. Engage in innovative partnerships to integrate oral health into whole person health home that are equitable, accessible, and accountable, following a community collaborative practice approach that includes telehealth and more, and knowledge of how to access at least 4 resources to promote oral health within a medical setting. Next slide. I will now turn it over to Deb. The floor is yours, Deb.
Super. Thank you so much. And thank you everyone for being here today. I am Deb Jacobi, Policy Director at Appletree. And I'm so pleased to be here because it often feels like what people associate with dental is all of the problems around access to care, not to mention for your clients and the people that you work with, the pain, the suffering, desperate use of the emergency room to get out of pain, and all of the cost barriers for people to receive care. I'm willing to bet anyone that works with Minnesotans has experienced this one or more times trying to obtain dental care for someone. So today, Nancy and Jane and I would like to refocus on why oral health matters and on the multiple opportunities, ways, places to integrate oral health care for whole person care. And I do feel like this fits just perfectly with the redefining health and redesigning healthcare that is the tagline on MDH website for health homes. So if next slide, please. This is a slide from CareQuest, the CareQuest Institute. And if you're not familiar with them, they have many, many resources. And this one is to show how dental diseases negatively impact the rest of the body. And it has prompted folks to use the tagline, let's put the mouth back in the body. That is in terms of both medical dental integration and breaking down siloed systems that prevent people from being healthy. All the links are going to be shared with you after the webinar, so no need to copy those down or try and grab those. And CareQuest is just one of the many resources where I think that you'll find policy points, how-tos, and statistics and data. Next slide, please. The first ever Surgeon General's report, when C. Everett Koop said, "You're not healthy without good oral health," and a subsequent call to action, took us a long way, I will say, in getting people to recognize the importance of oral health. But there's still a tremendous amount of work to be done. And I'm feeling optimistic about the work to be done. I think there's a lot of signs that we're well underway. Some examples would be that there's just a huge growing body of evidence about the return on investment of primary and preventive dental care. That's return on investment for the payers, for the health systems, and certainly for the people. And part of that is what's driving value-based care payment models, that incentive that, oh, if we add this and expend a little bit on dental, we will save a great deal for our diabetics, for our pregnant women, on and on, a growing number of cases where that is the case. And for care models themselves, there's a wonderful paradigm shift going on in dentistry. We're moving from a surgical model, kind of a drill, fill, and bill approach, to a medical model of disease management, and to new and some just being revived preventive treatments, things that will either stop the disease from ever happening or stop it in its tracks so that it does not become worse while people are struggling to find a source of care. On workforce, Minnesota was the first state in the nation to authorize dental therapists, and along with collaborative practice dental hygienists, these are preventive-oriented practitioners who can be deployed in a number of settings. Part of a health home could include having an oral health professional that is outside of the office, helping integrate dental care. And I just think that those forces or those trends are really going to be helpful in integrating dental care into primary care. Next slide, please. So this is a busy little slide, and I hope you will have a chance to go to the link for it, because you aren't going to be able to see the details, but it's from the Centers for Medicaid and Medicare and Medicaid Services about the barriers to oral health. And they have a section that's about the barriers for patients, for the providers, and for the government itself. I guess how government can help reduce those. And it fits very well with the health home description on the MDH website, that a health home is a primary care clinic or clinician certified by MDH to coordinate care among the primary care team, specialists, and community partners to ensure patient-centered whole person care and improve total health, wealth, and being. So I hope you will think of us as oral health specialists and as partners for the work that could be done together. Next slide, please. The model that Appletree, my employer, has used since its inception is what we call community collaborative practice. Initially, this meant that we partnered with nursing homes to bring dental care to the nursing home residents. And this was kind of a big deal because comprehensive care in a nursing home wasn't that common of a thing. But there were all these mutual benefits. We had access to the residents' caregivers, to their full medical histories. Everything was right there. For the nursing homes, it had the great advantage that they didn't have to send a staff person, use special medical transportation, take somebody who is on oxygen or in a wheelchair for what ended up being a half day or more outing to go get dental care. This could all happen on a regular basis right within their facility, a lot less expense for them and a lot more timely care for their residents. Over the years, other communities and other populations came to us for help. Up in the northwest part of Minnesota, Hawley area, it was low-income children and families that weren't able to get care. We've worked with residential care facilities or residences for people with IDD. We've been on a behavioral health campus and on and on and on. the thing that I like about it is that it is a highly customizable model. So whoever your partners are can come together and co-design the inclusion of dental care in the other services that are being provided, which, as you know, that's what a health home is all about. Next slide, please. One of the missing pieces for dental has been patient-reported outcomes, and we often lag behind medical in things. And one of them is we can say we did this number of fillings. We can say why we did those fillings, and so on. But we don't, other than a patient satisfaction survey, routinely have a way to say what has been the impact. And Appletree has been working with Dr. Mike John from the University of Minnesota. He's an international expert in this particular patient-reported outcomes measure. And I think if you click one more time, it'll show that what we're trying to do with this very simple 5-question 4-domain area is to see whether we have first establish a baseline and then see whether we have impacted the function, the pain or lack thereof, the appearance, and there's several psychosocial factors to this, like impacting one's ability to work or go to school or do those normal things that they do on a daily basis. So we're trying to move them from experiencing those negative things often to never experiencing those. And I wanted to include this in it, and I don't know if Nancy or Jane will repeat it, but we talk about integrating dental into medical. And this 5-question survey can be conducted by anyone, anywhere. And I think it is a lovely way to identify who is having issues in a standardized way, prioritize referrals, and then we can see whether we address their issues over time. And you could do an entire webinar or more just on this with Dr. John about how this fits into value-based care, how this fits into looking at health system performance, and even how it looks at ranking different treatments over treatment choices for people. So with that, I just want to be sure that I mentioned it, and we can go on to the next slide. Yeah, that last little animation is the goal. We want to get to everybody to never experiencing these problems. And don't worry about the details on these 2 infographics, because Nancy, you will receive the links to them. But the main point of it is I want to draw us back to the fact that so much of what contributes to health or to disease has nothing to do with the clinical treatments that we provide. So if we want to improve health, we really do need to partner with so many people. And I feel like dental is ripe for doing more with others. We have small little treatment operatories. We have small little appointment times. We see people one at a time and so on. And it's all good. And some of those things are needed. But if we are going to drive down how much need there is, we're going to need to partner with you and with others to address many of these other factors. Next slide, please. So this is just to wrap up before turning it over to Nancy and then to Jane, just to hit the high points or provide a little appetizers about what things we could do to move forward. And I mentioned before this paradigm shift from surgical to medical management of tooth decay and minimally invasive approaches. Silver diamine fluoride is something that has taken the dental world by storm in the last maybe 4 or 5 years. And it is a painless liquid treatment that is applied to a tooth that can be done at a school, at a primary care appointment, in a nursing home, Head Start, variety of settings, and that arrests the tooth decay. It does, as many of you may know, have some specific characteristics that make it important that families know that tooth decay will turn black when it is arrested, but we found that the public accepts it, loves it. If it means that a small child doesn't have to go to an operating room for dental care, they're all on board. If it means that a senior doesn't have to have a filling done because their root decay can just be stopped, great thing. And Nancy will talk to you about the medical dental integration community conversations that the Oral Health Coalition is undertaking. So just know that that's a highlight. And I just also want to call out that there's some really great advocacy work going on. Nancy is the executive director of the Minnesota Oral Health Coalition, and they're hosting all types of wonderful information and activities to move things along. And then just this year, a new 501c6 nonprofit association was formed called the Critical Access Dental Providers Association, but for short, that's CAD Minnesota. And we will be at the Capitol talking to the governor and everywhere possible to talk about all these opportunities to improve oral health. So we're trying to align policy and payment with good care. So expect to hear from us and maybe to be asked to partner with us on some of those efforts. Next slide, please. I'm guessing Nancy will show you this, and this is your own thing for those of you that work at MDH, but we have a roadmap. We have a great roadmap, and it was one that the MDH and the Oral Health Coalition did a lot of stakeholder engagement to gather information and to get new ideas, look at what's proven, put together a plan of action. So we're very fortunate to have that, and we need to see it through for a few more years. Next slide, please. And that's it. That slide's looking a little funny. I don't know what the conversion didn't do, but that's my email address. And I guess our little tagline, maybe if you click one more time, let's see if that comes up. But yeah, this is my shameless plug for my organization and to say thank you to you all. So I'm going to mute myself and turn it on over to Nancy.
Thank you so much. Not shameless at all. Next slide, please. So as I've been introduced, and thank you so much, I'm Nancy Franke Wilson with the Minnesota Oral Health Coalition. We are a statewide organization dedicated to improving the oral health of Minnesotans by broadening and developing stakeholder engagement and collaboration. I had a conversation with someone yesterday, and he said, you are of service to those who serve others. And I said, that's really beautiful. I love that, because we are here, I say for you, we're here to support people that are doing anything, including ourselves, to raise oral health to its rightful place within overall health while solving oral health problems affecting all Minnesotans. There's our website. It'll be included in the links, and I encourage you to join us, and there'll be more about that at the end of my talk. Next slide. I'm just going to run through just a few of the resources that are available, and they are really available. I mean, you can click on these today and get a hold of them and hopefully start using them. Next slide, please. There are more, but we'll start with these. We are very fortunate, and we can thank Jane Neubauer, our next presenter, for the Early Childhood Dental Network. It's a collaborative effort to educate children and their caregivers about the importance of oral health, and also to increase access to dental care for children ages 0 to 5 on Minnesota healthcare programs or uninsured. And we know that if we increase access to dental care for children, we're increasing dental access care for families, right? So it's very important. Next slide, please. So with their partners, the ECDN is supporting mobile outreach clinics to increase the number of the region's children who receive dental care and who are served by Minnesota healthcare programs. The ECDNs partner with Apple Tree Dental, Caring Hands Dentistry, to expand the community-based dentistry, and providers like Children's Dental Services to create and expand school-based oral health care. They also work with high schools and colleges to increase the number of students entering our dental field, and aiding medical clinics with implementing oral health screenings during well-child exams. And I think the big thing is the ECDNs provide an oral health advocacy platform. And how I always describe ECDNs is it's really, we have these regional early childhood dental networks, really everywhere in the state except for the metro area. And Jane and I hosted a meeting, or Jane hosted it, she invited me, a meeting in Fergus Falls last month. And I don't know if I go to meetings that are so much fun. I mean, I just learned so much. I met so many incredible people, what they're doing with dental, a lot of public health folks, clinic people. Um, I don't know if we had a lot of dental providers, but we had all these people that make dental a part of the work they do. Just awesome, really great. Next slide, please. And as Deb mentioned, we host a medical dental integration community conversations. It's the first Wednesday of each month. We have a variety of topics and it lasts an hour. Our presenters, what we tell our presenters is you have the full hour, you can talk for 15 minutes, you can talk for 45 minutes. And when they're done, we have conversations and people ask questions. If you're a member of the Oral Health Coalition, which anyone can be, you'll get notices emailed to you reminding you about these with the links. You can also go to our resources page on our website and it'll always have the link, the Zoom link, so you can join us. The next one will be happening September 4th at noon. Next slide, please. One of the things that the Minnesota Oral Health Coalition has done is created this Meet Your Mouth public awareness campaign. And it's kind of tongue in cheek. I don't know, we don't really say that enough in dental. We should probably say tongue in cheek a little bit more. But this idea to kind of introduce people to the idea that your mouth is important, that oral health is important to overall health, particularly, that correlation. I had someone, when I first started working with the Minnesota Oral Health Coalition, someone said to me, I don't know if you realize it, but our mouths are about 3 inches from our brain. So when we talk about disease, that's really a quick trip. And just some other ways, obviously the blood flow and a lot of ways that our mouth is part of our body. So we have this campaign. I'll show you a couple slides in a minute about them. So we have materials in English, Korean, Hmong, Russian, Somali, Spanish, and Vietnamese. And all of these are available on our website. What I want you to know, what's really important to us is, as an organization, as a membership organization, we want to be responsive. So if you go to our website and you think, geez, I really love Meet Your Mouth, but I need a different language. These aren't the languages that I primarily need. Just let me know. We'll get that done. That's important to us. It's really important that we meet the needs of people that serve others, that are doing this work. Next slide, please. So here's one of them. It's your mouth in the golden years. So we have a variety, like your mouth and vaping, your mouth and infancy, your mouth and pregnancy. So we have these one-pagers with the QR code. The QR code takes us to your website where there's a variety of resources. So someone says, I'm working on senior oral health or senior health care. I like this information, but I'd like to know more. Where did they get this? Where is there more information on that? That QR code takes you to those additional resources. Next slide. We also have, for each of the 15 areas that we cover in this campaign so far, we'll cover more if you let me know. We have 2 to 5 infographics like this. So this could be used in social media, in a newsletter. You could send it in an email. So yeah, we have these in other languages as well. We have those in the 5 additional languages as well. Next slide. A newer campaign that we're just slowly letting out to folks, especially this month, it's Vaccine Awareness Month, is what's called Get Your Head Out of the Gutter. It's a public information campaign promoting the HPV vaccination. And this is really, initially this was aimed at parents who bring their children to a pediatrician or their general practitioner, whatever that means, whether it's a nurse practitioner, physician. And it was started because personally, when I talk to people about the HPV vaccination, I don't think I've talked to anyone who outside of of our community with dental and medical who didn't say to me, my child's not having sex right now. My child's not my daughter's not going to be that kind of person or not. And so this get your head out of the gutter, it's really a play on that thought or that notion. And so we say it's get your head out of the gutter. It's not about sex. It's about protecting our children. So we know and we want this to go to community health workers and social workers, educators, all types of clinics. Right now, it's available only in English. It is on my to-do list to get a comparable message out for different languages and cultures, more important cultures. So we have this 8.5 by 11-inch flyers, and then we have deck cards. And again, the link to all these is on our website. Next slide. This is an up close of the top of our materials, what it looks like. And then next slide, this is the bottom part of one of our flyers. And we've actually created these the same. So if you go to the folder, you'll say, oh, they have the same thing twice. We actually have these two different versions. One version, it looks like this. The other version does not have the fourth little paragraph. So it doesn't include the names of the body parts. I had a couple pediatricians say to me, I don't really feel comfortable with the P word and the V word and the A word. And I said, well, let's not kill the project because of that. Let's give you both options. And I'm super happy. I heard from someone just 2 days ago, and it kind of gives me goosebumps. And she said, oh, I love the get your head out of the gutter, and we're using it. And I thought to myself, I didn't even talk to you about this. I didn't even know how you found out. You read the newsletter, I guess. So I was really, really thrilled with that. Next slide, please. And here's just a minute on the HPV vaccination. It's recommended as a routine vaccination at age 11 or 12, although now the vaccination may be started at age 9. And there's some ads being run on television now, and they're talking about how a young boy, the mother said, oh, we're at the age of the side hug now. I can't grab him like I used to. He wants just a side hug at age 9. It's kind of, I really like that ad. The Advisory Committee on Immunization Practice recommends vaccinations for everyone through ages 26 years if they weren't adequately vaccinated when they're younger. The vaccine is given in a series of 2 doses or 3 doses, depending on the initial vaccination age. So if someone is vaccinated by age 14, it's 2 doses. If their first vaccination starts at age 15 or older, it's 3 vaccinations. And for people that are over age 27, we've had this discussion a few times. Can I still get it? Would it still be worthwhile? And that's where we just say, talk to your clinician about that. They're the best ones to answer that and give you more information about that. Next slide, please. This is another resource that we created. And again, this wasn't on any strategic plan or any grant proposal. This was something that came from pediatricians that directly talked to me about it. And they said, we really need simple fluoride varnish training video. The one I used to use is no longer available, or it's no longer working for us. So we created this really brief 4-minute application instructional video. It shows the knee to knee method. And then when we developed this, we said, there's a lot of questions that go along with fluoride varnish. So why don't we create a parent guardian video that's maybe 3 minutes that just says, hey, what is fluoride varnish? Why is it being applied? How is it being applied? And then, hey, when we leave the clinic, what do we have to do? Do we have to wait an hour after the child eats? How does this work? So we developed a parent guardian video that's now in 21 languages. And it's all available. They're all available on our website. So if we have a second, if you don't mind just playing maybe 30 seconds of it. Yeah, we're not hearing it, but you can go visit it. It's 2 minutes and 17 seconds. Yeah, that's okay. As long and like I said, I just encourage you to go to our YouTube channel if you want to and watch it, and then use it widely. If you or someone you talk to says, "Hey, I don't have any way to show it using an iPad or something like that," let me know, and I can send you actually a disc. So say, we have a DVD player in our waiting room. I can send you that on a disc. Next slide. And here's the list of the languages that we have. Again, very proud of these languages, and we will do more if someone lets me know. Really happy with Ojibwe. I had someone contact me and they said, "I know an Ojibwe speaker and we'd love that." And I said, "Boy, I can't get that done fast enough." So next slide, please. And Deb mentioned that Minnesota is a leader in collaborative dental hygiene practice, and we're really proud to be the home of the collaborative dental hygiene practice toolkit. It's on our website, and it was developed with Dr. Colleen Brickle and her colleagues at Normandale Community College in collaboration with people like Deborah Jacobi, just a number of other folks throughout Minnesota with different organizations that worked on this toolkit. And next slide, please. The toolkit was actually created for the Normandale website, and recently Normandale was told that it had to be taken off to make room for something else. And we offered and accepted that we move it to our website. Collaborative dental hygiene practice in community settings authorizes Minnesota licensed dental hygienists to practice within a community-focused model, resulting in more people with access to preventative services in finding a dental home. They provide coordinated care to under-resourced populations, and Deb mentioned this as in non-traditional healthcare settings, nursing homes, schools, churches, anywhere that they can go. And we always say, if there's a water source and electricity, and we know that I'm trying to think of something, even community centers, anywhere you can think of. And what we love is that one of the problems that people have with accessing dental care, in addition to just finding the care, is someone who says, I work and I can't get off work to take my child, or this clinic isn't on a bus route or something like that. And we know that when we have a collaborative dental hygiene practice hygienist, they're going to go to where the people are. So it was first, this model was authorized by the Minnesota legislature in 2001. Subsequently, there has been some changes to the authorization just to make it better, if that's possible. But services may be performed without the presence of a dentist or without a prior exam of the patient by a dentist. So again, just really working hard to improve access. Next slide, please. So I encourage you to join the Minnesota Oral Health Coalition. We're open to everyone. We let you know about things that are going on. You can find us on YouTube. Most everything we do, we will record and put on our website or put on our YouTube channel. We will be returning in 2025 to an in-person conference. And again, we hire someone, we started this when the coalition started, that we have someone record our meetings because we never want anyone to miss out because of their geography, right? That's just really, really not okay. And people being busy and saying, you know, I can't get there on that day. And we can say, that's fine. You can access everything on our YouTube channel. So thank you for listening. And I do hope after this, we get a lot of new members to the coalition. Thanks.
Thank you, Nancy. So I am Jane Neubauer, as referenced earlier. I do work as the Region 4 Dental Innovations Coordinator, and I do also help to facilitate the work of the Early Childhood Dental Network that Nancy talked about earlier. What I'm going to visit with you a little bit about today is some of the information has already been covered, but really what can we all do? What do we all need to do to pull together and help address the disparities that are really out there? We all know that dental disparities really impact all ages, all genders, also socioeconomic backgrounds. Being located in rural Minnesota, we have a higher number of Minnesota healthcare program enrollees proportionately, and a vast majority of those folks that are not able to access dental health care regularly. So we know that it affects an individual's quality of life, short-term and long-term. You know, when you think about it, how hard is it to get a good job when you have a poor smile, right? It's really, really difficult. And so the other piece of that is really to help with the long-term outcome of generational disparities with oral health. If we start early, if we start with our children, we really have that impact in the long term, or the ability in the long term to impact that outcome for our kids and family. I know Deb and Nancy talked a little bit about the issues that contribute to, or the other health issues that are attributed to dental care and oral health care, so I won't go into a lot of detail on that. But really, we're looking for help. We need everyone to pull together on this topic. So next slide, please. So poor oral health in early childhood, it's a huge part of all of the work that we all do. We know that cavities are the most common chronic disease of childhood, right? We know that it creates difficulties with eating, speaking, playing, learning. It really impacts our kids in a big way. We know that kids with poor oral health often miss more school and they receive lower grades. And how sad is that, right? Because our children aren't able to learn when they're in pain each and every day as they're attending school. So next slide, please. This is just a little bit of data about the state of children's oral health. We know that a very large number, at last count, 51 million school hours are missed each year due to dental related illness. If our kids aren't in school from dental pain, they're not learning. And if our kids are in pain when they're in school, they're not learning. 164 million work hours are lost. That's parents, caregivers that are taking their children to the dentist or staying home with a child that has a dental pain, right? Parents can't leave their kids home alone, and so they're missing work hours. And we know that pediatric dental disease is a primary reason for emergency room visits for children. What a huge cost and expense to all of us when we have children that need to be seen in emergency rooms because they can't see a dentist. And then sadly, of course, we know there's just a large number of children in America that have no access to dental care. So next slide, please. So what I'm going to talk about a little bit too is some of the things that we do through both our Dental Innovations Project and through our early childhood dental networks throughout the state of Minnesota. What we really try to provide is designated community support. We're here for you. We want to partner with you to address the disparities that are out there. Some of the primary folks that we work with are child and teen checkup programs. And other oral health collaborations, obviously the Minnesota Oral Health Coalition, the Minnesota Oral Health Programs, partners like that. We work really hard to incorporate oral health care and prevention as part of early childhood home visiting programs and well child visits. We know that within our public health programs, there's a variety of different home visiting programs where we have family health nurses that are going out and visiting with families of young children. We work closely with them to give them resources and provide information that they can provide to families on oral health. And then, of course, educating employers on the impacts of oral health. We did a session, I believe it was last year, for employers in the region, talking about the importance of dental insurance coverage. If you don't have dental insurance coverage, it's a lot more expensive to go to the dentist, right? And then encouraging employers to encourage their employees to use their dental insurance. Sometimes people don't really know what their dental insurance covers. So it's always a good thing for employees to do. Some of our state and local partnerships, we work closely here in our region with the SHIP program. Many of you are aware of the SHIP program, the State Health Improvement Plan, who are closely connected with our school wellness committees. So what we do is attend our school wellness committee meetings. That's a partnership of school nurses. It can be administrators, health teachers, you name it, just a variety of folks that are involved in the schools. We have been slowly but surely adding oral health to those schools' annual wellness plans and district-wide policies. To date, we have 17 districts in my region, and to date, we have 4 of those districts that have actually signed up and embedded oral health policies directly into their school wellness policies. So it's really a good thing. It's a great thing to have oral health being recognized right up there along with physical health and emotional health for our kids. And then another project that is closely related to oral health is vaping. So we have worked with school districts in our region to provide vaping education, and some of our positive community norms specialists in the area to help promote the importance of that vaping message, anti-vaping message, I guess I should say, and then how that also affects your oral health. So just a lot of different components with that. Next slide, please. So this is just a little snapshot of our dental education that we've been working on over the past few years. We started out with a goal of educating 400 students, and last year was our 3rd year of the project, and we educated over 5,000 children so far in 2024 throughout our region. This was a partnership between the Dental Innovations Project and 6 different dental providers and 24 schools. So really a great way to help educate our kids. And this is a repeated effort. So it isn't just a one and done. All of these schools that are participating have done this annually and have signed on to agree to have that education annually to keep the message moving along. So next slide, please. So these are just some of our usual partnerships. Many of you I see on the call with us today and recognize some of your names are partners with us in the work that we do. Obviously, public health is a huge hit for us. We have lots and lots of public health partners and programs that we work with. Primary health centers, lots of our primary healthcare providers that we share information with and utilize as experts in their fields. Mobile clinics. So this is something that Nancy talked about earlier, where we work with our nonprofit dental providers in the region to help them start new mobile outreach clinics and help them fill the outreach clinic spots that they have. So we started out in our region with well, 1, obviously, start with 1 at a time, right? But in the first year we had 4, and at last count we have 24 mobile outreach sites available in our region, throughout in this region in rural Minnesota. So just a really huge part of that. And then of course, early childhood education as well. So while we work hard to educate students on the importance of oral health, again, we just can't stress it enough that early childhood is where you need to start with education with oral health. As soon as that first tooth comes in, and even at birth, educating parents about the importance of caring for gums and getting children used to something, a toothbrush or a finger brush in their mouth to clean their gums. So those are kind of our usual partnerships. And then next slide, please. Some of our unusual partnerships that we have endeavored lately is a jail project. So that is something that we worked here in Otter Tail County to determine how can we best support the people who are incarcerated and the staff who are working with them. Oftentimes we know that people who are incarcerated for a variety of reasons also experience a higher rate of dental decay, right? And so our goal here in one of our counties was to help those folks to access dental care as soon as they are released from jail, so that they are able to have one less barrier to being successful and staying out of the system by helping them address those oral health care needs. And along with that jail project goes the opioid epidemic. So we know that certain drugs, prescription and non-prescription, can affect your oral health. Again, really our goal was to help prevent those repeat flyers in the emergency rooms that are drug seeking, that are looking for, pain medications for a variety of reasons, and sometimes legitimately because they do have dental disease and pain, and they're trying to stop the pain from that. So that's just kind of some of our unusual partnerships that we have. And then next slide, please. So these are some of the workforce challenges that we have talked about. Nancy and I worked closely on a dental assistant workforce project where we developed some different materials, and we worked along with the Minnesota Dental Association to create some materials to help promote those different professions. We have a serious shortage of dental professionals in rural Minnesota, of all types of dental professionals. Nancy and I are actually working on another project right now for some video advertising to help promote dental professions and the importance of keeping dental appointments for people. And then flexible staffing, that's another model that was explored and identified. So one of our partners has a project where they have very, very part-time dentists that come into their facility and provide care. And they can work one day a month or one day a week or 3 months out of the year, whatever that looks like for them. And after sharing information about that with one of our other nonprofit dental providers, they were able to expand their process too for hiring very part-time dental professionals that can help to fill the gaps of the needs that are out there for dental professions in our region. So that some of those ideas are the things that we carry over, that we share, that we learn and grow from each other, and ask all of you to share and learn and grow with us as we develop those models. There's also, along with that, there's a lot less duplication, right? If you're looking to start a project or you have a need to learn more about something, just want to start talking about what you need in your region, give us a call, because that's what we're here for. We're here to help you. We're here to help you learn and grow from what others have already done. Next slide, please. So these are just a few top strategies, and again, just driving home kind of what the need are and what we can all do together to focus on improving oral health. Once again, the top number one, I can't express it enough, an ounce of prevention is worth a pound of cure. All of us need to start early. We need to help our families. We need to help our families with young children recognize that oral health is very important and a very important part of their long-term outcomes for their kids. Education, again, education is the most powerful weapon you can use to change the world. So let's all educate. If you don't have tools and resources for oral health embedded in your education toolkits, get a hold of us. Nancy shared some of the great resources that are available on the Minnesota Oral Health website, and we have lots more that we can recommend. Coming together, we all need to stay together. We all need to address these efforts together. None of us are an island. The more we can partner, the more we can collaborate, the better off the outcomes will be for all of our families and our kids and for our organizations as well. So number 4, it's a little long here, but we need all of you to join us in our day-to-day efforts. Here, simple things, simple ideas, simple strategies. Assign someone from your organization to attend the monthly medical dental community conversations. One quick thing that you can do. Maybe it's you, maybe it's someone else from your organization, but it just gives you that reminder each month. It gives you an opportunity each month to ask questions, share ideas, share information, and of course, learn. Very, very important part of all of this. So again, I can't say it enough, but encourage those dental visits by age 1. We know that not all providers will see patients at age 1, but help our parents to be advocates, help our caregivers to be advocates, to request those visits for their young children. And next slide, please. Fluoride. We can't talk highly enough about fluoride. I know Deb had talked about silver diamine fluoride. That's another strategy of type of fluoride. Preventive fluoride is also great, especially for us in rural Minnesota. Many of us live in rural communities where we do not have fluoridated water. We have well water. We have many rural communities that have well water households. Talk with your families about that and the importance of fluoride. Healthy eating, of course, we can't stress that enough. Healthy eating is a huge part of our oral health. The prevention part of it, keep stressing that good eating and habits, oral health habits from the get-go. Seek and offer those resources. Help those families find dental care, especially those families that are utilizing Minnesota healthcare program insurances. We know that you are likely in your primary care settings to see the same patients that we're talking about. Families are accessing their primary care facilities for their well child exams. Talk with them about those dental visits. Next slide. I think we went back one, so go 2 more forward there. And this last slide here just talks about the dental innovations coordinators throughout the state. As Nancy said, we cover much of the state, much of our state that is health shortage areas included. One change from this slide that occurred just very recently, 7E, Alexis Roberts has moved on to a new position, so that spot is vacant currently. But there's many people in the neighboring communities that you can reach out to, and this information can be shared. So reach out to us, contact us, let us know how we can help you. That's what we're here for. And I think that's it.
Wonderful. Thank you so much, Deb, Nancy, and Jane. So much wonderful information regarding oral health and such great initiatives going on with such wonderful resources as well. If you have any questions right now, please put them in the chat. I know we haven't had a chance to get to too many. We've had one question that seems to be answered in the chat, but if you have any more, please go ahead and put them in the chat at the moment. I do have one question for you ladies while people are chatting, putting questions in the chat. If a clinic wants to incorporate more oral health initiatives, if they don't have any currently, what is one of the easiest ways for them to get started? Is it recommending oral health visits, or kind of what is their best way to get started?
I can just throw that out there. I really
Yeah.
feel one great way is reach out to one of us. Reach out
Okay.
and find out what's already going on in your community.
Yeah.
And also we may have contacts for you just based on some of the work that we've done throughout the state. But Deborah, Nancy, do you have other ideas on that?
Well, I would just say the same thing, partner. And there are a lot of, of course, I think Apple Tree is a great partner, but there are a lot of organizations doing that. And I mentioned this about community collaborative practice, whether it's us doing it or others doing it. It really is unique to that community and the population that you're trying to serve. So the coalition is ECDN is a great place. Coalition is a great place. And there's a dental services advisory committee at DHS. That's another great place to know people that are trying to shape policy that will help solve these problems.
Fantastic. Sadie, we have one guest that's asking to see that last slide, or the 2 slides ago, if you wouldn't mind. Just catching the last second slide for the 10 strategies. So fantastic. So Sadie has put the evaluation in the chat for us. And I want to thank everybody again for joining us for this Healthcare Homes webinar. Please don't forget to complete that survey that Sadie put in the chat. This helps us now, and it also helps us plan for future webinars. And as I said, want to say a huge shout out to Sadie Anderson for everything she does in the background for us. She makes these things run. I couldn't do it without her. She's amazing. So you will receive a follow-up email from her as well, as soon as with the slides and resources, along with the resources that I believe it's Nancy that's going to send us our way, and we'll send them on to you. And if you have any questions, please don't hesitate to contact us at our email address. It's the health.healthcarehomes@state.mn.us. We'd be more than happy to help funnel the information to where get you answers to the questions that you need to know or that you have questions for. There's our email address, our website, and our phone number. Multiple ways to get a hold of us. Please don't hesitate to reach out if you have any questions that you want answered. And thank you again, ladies, so much for your
for having us.
knowledge and participating in our webinar. We can't thank you enough. And have a great rest of the day, everyone.
Thanks.
Thank you all.
Bye, everybody.